what are some of the things that the clinicians are coming to you with most frequently? Is it the documentation? Is it the caseload? Is it communication? And how are you providing that? Do you do weekly check-ins with your SLPs? Are you doing office hours? How are you providing that support?
So currently, and it's because we're still sort of in the beginning of the school year, a lot of the issues are like coming out, like caseload size. Like I don't have enough time to do everything. So, the caseload size is too high. And so therefore I'm, you know, trying to squeeze in time to get the documentation done, to get that billing in, access to systems. Sometimes
Oh,
that's a,
goodness, yes.
yeah, still trying to work out those kinks. So yeah, those beginning of the year things are what are coming to us now. And, some of it is, again, it totally depends on the district and who the leaders are at that district. And some clinicians have had that chance to, maybe they interviewed with the person that is now their contact person, and or they've had some other, time to interact with them. And so we'll coach the clinician and say, hey, like, who is it that is your contact person at the district? And do you feel comfortable going to them and explaining, this is a situation? What are some of the, here are some of my recommendations for solutions. What do you think? Whether that is looking at the caseload sizes across, the district to, maybe another SLP could come in for, a couple of days or a day to help alleviate, or maybe they do have SLPAs. Is it possible to move one of, have a SLPA shared, with another site? Just some of those problem solving. And at some districts, unfortunately, the person who does the interviewing is not the person that is then the contact for, our clinicians. So,
and then you work virtually, and then so you've never met these people in person. So now you're playing email tag with them, and everybody's sending emails. So then that's a whole nother thing too. So you just kind of help bridge that gap and help support that clinician in saying, okay, yes, this is something, and this is kind of the contact person with the district. So you're not usually the one going to the district saying, hey, I have an SLP over here who's really struggling and can't keep her head above water. So you're just supporting that clinician and going to making sure that they've got those contact people in their district.
Yeah. And sometimes I will step in, and again, kind of depending upon the district, like if we've worked with them in the past and I've connected with somebody in, a leadership role that is our contact at the district, like an AMN contact at the district, I might reach out directly and say, hey, this is what's going on. I've problem solved through a couple of things. Do you have any recommendations? Could we set up a meeting to discuss any, like the concerns, or I might just say, hey, our clinician is trying to get a hold of you, or somebody, maybe we don't have the correct contact person. Who should they be reaching out to?
Right.
So it is, it's definitely, I'm bridging that gap, but I'm more than happy. Any of us are more than happy to jump on a call with a district and try and problem solve with them as well, because maybe they haven't thought of hiring an SLPA, or, maybe they just have no idea what happened at this clinician site. And so, getting in front of somebody, on a call,
and opening up that communication. Yeah.